All right, we got some people coming back in. Good evening, everybody. Marlon is here. Michael's back. Chris made it back. Awesome. Abby made it back. Joan made it back. Awesome. Deanna made it back. Great. I'm going to be letting people into the room um, real quick while we do this. It's about 5:34 right now, and as I was saying to Karn, I need some better light. I'm kind of hiding in the dark over here. And here's Nofi. Nofi was, I believe, had popped in earlier as well. So we'll wait till everybody kind of gets settled in, make sure everybody's connected, and then we'll jump into this whole thing. Let's see. Ellen was going to come back and join us. Let's see if I don't see Ellen yet. Joan is here. Welcome back, Joan. Victoria, welcome back. Awesome. You made it. Great. Cool. So we got 17 people. We had about 45 or so on the RSVP, and then I know we had to push back by an hour, so some people uh, are either going to come in late or aren't going to be able to make it at this time. But we are going to record this for those to watch afterwards. Those who couldn't make it. Before we get started, I wanted to introduce everybody who is here tonight. My name is Tim Friedlander. I run the kind of founded the Gardner groups here in Los Angeles. I own the Soundbox recording studios, Soundbox LA, and the other studios here in Los Angeles and Colorado. Voice actor as well, and have been full time in voiceover since about 2016. All the while working with JD for the last 10 years. He's been my insurance guy for the last 10 years to help me out with this. We have Karin Gilfrey, who is founded the New York NYC Voice Actors in New York group, and helps me as one of the admins in the Gardner Collective, and is here in Los Angeles. And she's going to be joining us for this first part of this. Before we get started, I just want to say, kind of what our plan is for this evening and the purpose of putting this together. I've been, for those who don't know, I came out of teaching. I taught for 12 years in the elementary level, and I was a freelance. I taught at multiple schools, and so I didn't ever work at any school long enough to qualify for health insurance. And about 10 years ago or so, I connected with JD, and he has helped me navigate the insurance world for the last 10 years. I've referred people to him multiple times over the years to help them out. And he and I started talking last year, I guess a little over a year, about some options for voice actors and for those of us who don't work in a traditional setting and have some options for that. So what we wanted to do tonight is bring in JD and kind of give us a realistic, current real world info on what is happening for insurance, what our options are, what the reality of these options are, what we can and can't get, what we might be able to work out, what we can do. Hopefully, there is a way for those who need or have some special circumstances to find a way to make this work. And we're going to talk about all these options tonight. Hopefully, if you have any questions, probably I would say go ahead and throw them in the chat, and we'll try and work our way through those. JD's got a lot of information, so I think a lot of questions that maybe you may have may get answered for you. If they don't, definitely feel free to drop them in the chat. And with that said, I would just like to introduce JD Ward. He's right in the middle from me. I'm not sure where he is for anybody else. Who is definitely somebody who I go to when I ever have any, whenever I have any questions, and try and make sure that I can get a real answer about things. I know there's a lot of discussion on Facebook and other places about what options are and what options aren't. And so we wanted to put this opportunity together tonight to hopefully get some direct answers from somebody who can tell us exactly what's happening out there. So with that said, I'm going to turn it over to JD, and welcome, JD.
Hey guys, thanks for pushing back. I apologize. One of my cohorts that's going to be hopefully jumping on here, one of my ringers, he got stuck traveling and got stuck with a few things. So I appreciate you guys, being very flexible. Hey Ty, what's up, dude? Nice to see you. It's been a while. So when it comes to insurance, there are lots of different options out there in the marketplace. And that's kind of what I wanted to do in terms of give you guys a lot of information as far as your choices. Tim said that most of you guys or most of us are going to be in LA or California and New York. So to kind of start with that, both those states have the healthcare exchanges. So you can go in, you can get your subsidies. You can qualify for that based off of your taxes. I know that being a 1099 employee, sometimes that stuff isn't necessarily very savory. So we do have other options in regards to what we can provide in terms of, affordable healthcare. One of the options that we have out there is what's called a MEC plan, or a minimum extended coverage, by a company called Apex. It's not traditional health insurance. And let me kind of digress a little bit here in terms of, how health insurance works. And this is something that I've been battling, ever since I got into this arena 10 years ago. I mean, health insurance is a part of what I do, but it's not all what I do, because the way that, the healthcare exchange and the, ACA or Obamacare has really changed the game. But unfortunately, what we're pushing up against when it comes to health insurance is that we live in a for-profit society. This isn't Canada. This isn't something where it's a given right to have health care. So when it comes to the options that we have and why things are expensive and why things are so shitty and can be really frustrating, is because we are operating in a capitalistic arena where health insurance companies need to make money. Now, with that being said, on the cynical side, I'm very positive with the options that we have and what we can provide in terms of the choices for 1099 employees, people that are just building their book of business in terms of your voiceover business. You probably have a second job, doesn't provide healthcare. And so that's why I started with, you can get your healthcare solved through the healthcare exchanges and through Obamacare or the ACA in California and through New York. Arizona, I think, Ty, I'm not quite sure if they have one. What did you find out when you moved there?
I haven't changed my insurance yet. I've just kept my California insurance. It's under Covered California. But I pay for the best insurance they have, the Platinum PPO.
Yeah.
So I was hoping to just use that until they tell me I can't.
Right. Okay. I can do some more research, but again, Arizona is one of those states. It's please forgive me. I'm not trying to be political, but it is factual that some of these redder states don't jump into, the healthcare, government healthcare arena and offer that. And they offer these other plans like the MEC plan. The MEC plans are minimum extended coverage. And then, Tim, can you give me control here?
Yep. Yeah. Do screen share. That's what you want me
Yeah,
to
just give me a screen share real quick, and I'll show people what I'm talking about when it comes to
Cool.
The minimum extended coverage.
And before we do that, let's just check and see. Now, I know we've got a lot of people in New York and LA. Do we have, who here is not in New York or California? Do we have people who are outside of? Okay. And I know we've got Boston, Philadelphia. Chris is in Philadelphia. Joan,
New Jersey.
Okay, we got New Jersey. And Lisa, you're in Philadelphia, or are you in Pennsylvania?
Philadelphia.
Yeah, Pennsylvania. Okay, so like New Jersey, I think some of these states do offer the ACA. Again, just kind of going down the checklist here in terms of, what options do we have? Because I know a lot of people that are on this are worried about options. They want to see what their options are. And again, please forgive me. I'm kind of, exploring some options that you probably already know about, but these are things that I can help consult with. Even though I'm in California, these exchanges and the way that they operate are fairly similar. The plans might be different, but they're basically the same. And so with this minimum extended coverage plan, which is a basic plan, this is nationwide. This isn't going to be something that's restricted by the state that you're in. But again, it's not traditional healthcare. For those of you that are looking for traditional healthcare, I just want to say that it's not traditional healthcare. We can build it out in a certain way that covers all of liabilities, but let me show you. Do I have control here, Tim?
You should be able to share. Yep, I turned it on.
Okay. Can we see this or no?
Not yet. Let me make sure.
Let me see. Share screen. Okay, here we go. let me scroll up here. So this is one option. And this is for an association, independent contractors, part-time staff. It is ACA approved. So, and I'll show you where that goes into effect, but it's minimum extended coverage. But anybody anywhere can get this. If you don't have health insurance and you want some sort of coverage, you want access to doctors, access to prescriptions, you want something in place, and you can't quite necessarily afford, what's being offered, or you want to stay flexible, this is better than nothing. I'm not going to say that it's amazing because it's not. It's not typical healthcare coverage, but I'm trying to give you guys everything that we have in our arsenal so that you guys can make the best decision for yourself. And again, I can share this particular PDF. I can send this out to Tim and share this PDF for you guys to have and to look at. But this is minimum extended coverage, like I just said 800 times. And you get preventative benefits. You get all the benefits that you normally would have as far as preventative services with a network, at very little copays. And again, I'm just going to give you kind of a quick overview here. And, at the end of this, Tim's going to share my information and I can field questions through email and really, help you guys in terms of answering the questions and consulting as best I can.
And to add that, JD, I meant to mention this at the beginning. There's no obligation for anybody here. If you have questions, reach out to JD. Karen and I have no financial gain in any of this. We're just doing this to help everybody out, purely to try and help people with information. So if you have questions, definitely hit up JD. We're not in the middle of this by any means at all. So.
Yeah, and for sure, I'm just trying to help out as well because, with the coronavirus happening and the pandemic, with the way that the world is kind of, I want to be able to give options in terms of what we can potentially do to help you navigate, and getting some sort of basic coverage or helping with the coverage that you already have, just being a resource and being able to help is my goal as well. I don't have a dog in any of these fights in terms of, I'm not going to push anybody in any direction in terms of whether you want to buy this product or buy that product. I'm here just to disseminate information and help you understand what's out there, just because we're in the age of misinformation from everything from, just everything. It just seems like there's a lot of misinformation out there. So this whole minimum extended coverage is a basic plan. It does have indemnities basically for hospital confinement. I don't know if anybody can read that. Let me see if I can give this a little bit bigger of a boost. Again, not traditional coverage. This is not traditional coverage. Like if you were in the hospital for 30 days, it covers 30 grand. There are supplemental insurances that are out there that we can build into this to make this a more comprehensive plan. But again, I'm not selling this as something that's going to work as major medical. Okay.
Is this something that a lot of doctors take?
Yeah, they do have a network that you're able to call and able to go and access. So yes, this is a product that has an extensive network. As far as doctors that take, I don't know if your particular doctor would be taking this. You might have to go to their default. Well, you're probably going to have to go to the default group. So yes, if you're tied to a doctor, this is, again, healthcare is, and even the doctors are kind of in on this when it comes to, how they get paid. Let me just show you really quick where it says it's ACA compliant. Right here. Because there are fines when it comes to, the whole covered California. Personally, I would rather we do a group plan, or I help someone consult with them getting major medical through their, exchanges or some sort of regular insurance. This is really a stopgap, nuclear option that, hey man, if you don't have anything and you can't afford anything else, this is better than a kick to the head.
And when you're saying, like, when you refer to traditional insurance, you're talking about then that something that would, I guess, what do you mean by that? Like, looking at this, I'm not quite sure how this would vary from traditional insurance.
Well, this only gives you certain indemnities of, like, let's say hospital intensive care unit. It only gives you $10,000, basically a $12.50 per day per plan year. And if you're in the ICU for, I mean, look, you know, in the real world, if you, you know, like if you, you went to the emergency room, they'd give you $150. And let's say you had to be in ICU for 3 days, then they'd give you $3,000, right? And then,
as opposed to covering what the cost of that stay would be.
yeah, so, you know, I was recently in the hospital a month ago to get something fixed that snuck up on me. And it was a major surgery. I don't want to get into the gory, bloody details. I mean, it was a major surgery. And, you know, my out of pocket is $6,000 because I have a basic major medical through Covered California. I'm sure my surgery was in the couple $250,000, $300,000 range. I don't know. I haven't seen the full bill yet because they, you know, that stuff takes a while, but I do know that, you know, I'm going to have to negotiate and pay my pay my out of pocket. Now, with that being said, everything with my insurance now is going to be free for the rest of the year. So that's kind of the thing, is that, you know, nowadays you go into the hospital, let's say, and let's use a really terrible example. You get coronavirus and you're on a vent and you're in there for 15 or 20 days. I mean, sure, they're going to give you $30,000, but I guarantee you your bill's not going to be just $30,000.
Right. Okay.
And so that's the problem with this whole thing, is that it does give you basic stuff, right? You can see primary care physician specialists. You can go to urgent care. You know, you can, if you, you know, they give you some basic options for your prescriptions. So again, it's not major medical, but it's better than having nothing, I think, in my opinion. I do have some clients that are on this and they seem to use it and like it quite well. They haven't gotten sick or have had a major, you know, surgery or major medical incident, no coronavirus, which is great, but you can't predict that. And so, you know, with insurance, you're always insuring for something, you know, the worst case scenario, like myself.
Yeah, and this is what I was on. You know, I think when you and I first met pre Obamacare, pre ACA, this is what I was on, something very similar to this one to start with, and then moved up. Car, do you have a question?
Yeah, I have kind of two general questions. The first one, though, which I think is important, is can we talk about deadlines for signing up for health insurance? Because I know that you're kind of locked into a plan for a year unless you have a qualifying life event, which is what happened to me back when I bought my own health insurance through the ACA. I had like a catastrophic insurance plan where I was paying the least amount possible, but then I just got pregnant, and then I could pay for a better health insurance plan in the middle of or maybe it was at the start of the next year. I don't know. Anyway, but can we talk about deadlines for when people have to decide and how to research and all that kind of stuff?
Yeah, for sure. So the open enrollment period is from now. Actually, it's November 1st. Yeah, it's November 1st, so it's in 2 days.
December 1st?
November 1st.
November 1st, so from beginning.
Yeah, so from November 1st till the end of January, I believe. So it's 3 months, and that's the open enrollment. That lasts the whole year. So if you get a plan now, then your plan will start January 1st. If you wait till just before January 1st, your plan will start February 1st. If you have a life-changing event, like you get a divorce, you get married, you have a kid, you move from one county to another, or state. If you are on a group plan now and you get fired, like you lose your job, you don't quit, you lose your job. Those are all special enrollment periods that when you get 60 days from the beginning of that special enrollment period, you get 60 days from that start to be able to jump into getting a new health plan. So let's say on March 1st, you get married and you need to get a health plan for you and your new spouse. And you guys were both on individual plans. You'll have till the end of April to get into a new health plan. Otherwise, you have to keep the health plans that you're on for the remainder of the year. So every year there's open enrollment, and it's from November 1st till the end of January.
Cool.
So the special enrollment periods you can generally research, but those are basically the special, any life-changing event, or if you move from one county or one jurisdiction to another. That's how that works when it comes to the ACA. Now, some states don't offer the ACA, so you're kind of screwed in those states. You get what you get and you don't throw a fit. But I think that more states are now kind of jumping into that. I'm trying to think, I think maybe Texas has it. I need to look at that. But like Idaho is one of those, caveman states where they don't offer that. But generally like New Jersey, Pennsylvania, I think, Washington, D.C., I think Arizona does not. It might, though. But that's super easy to look up. And again, I can help people look that stuff up and consult with all that stuff. And before I throw that out there, I don't charge any fees, with any of this stuff. I'm just here to help. Health insurance is kind of, excuse the language, kind of a clusterfuck. And it's a clusterfuck for even myself. In terms of, when I started in this business, I was getting paid 25% commission, and now it's down less than 1%. But I'm in the business of helping people, and Tim's been an awesome client of mine, so that's kind of why I'm here. But we do have another option for everybody. It's a little bit more expensive option, but you get what you pay for. Is that we can also do a group option for everybody, which is possible. There are a couple of hoops that we need to jump through. The one hoop is that since you guys are an association, the group isn't a normal employer-employee relationship. So they're not going to be able to pay for half of the insurance, which is how normal employers, attract and retain employees. So whatever we look at, we can look at plans and construct this any way we want, but just understand going into this, when we look at the group benefits of stuff, it's going to be full price, which that's going to be anywhere between $200 to $1,000 a month. But the benefits are going to be really good. And then the other part of this is going to be a pay mechanism, which is a more of an admin side of stuff. But it is possible, because I know that Tim said that there were a couple of people that didn't think it was possible, but we can do a group option. There's just a few more moving parts, and it is going to be a little bit more expensive, but it is going to be a lot more comprehensive on the benefits side in terms of, giving you good regular group benefits, like real group benefits. So just to kind of give a recap, we can look at all the exchange options and the individual health insurance options through your states. We've got this MEC situation, which again is better than nothing. You just can't get hurt or get corona or break and have to have open heart surgery, but it does work. And then we can construct, if people are interested, some sort of group benefit option. Even though you guys are in multi-states, we can totally do that. It's completely possible. Again, like I said, there's a few more moving parts, but that's what we're looking at in terms of how we can, offer choices. And none of these are silver bullets, because if we do the group, we've got to pay for it. And if we do the MEC, then you just can't get sick or have anything really, really bad happen to you. But we do have supplemental insurance to cover the big stuff like cancer, heart attack, stroke. There are accident supplements that we can build in. And then we can also take a look at what's happening in terms of stuff that's going on in your state. As far as major medical, these are some of the covered California plans here.
And
Ty talked about the platinum plan. Can you guys see this?
we're not seeing that
No.
yet. No, we're still seeing the other one. And then
Okay.
we do have a couple questions, and this is kind of the I have not seen Nine Perfect Strangers, but we'll see. A couple of the questions. So yeah, so the group thing is very interesting because there are some definitely adamant saying that it's not possible by any means whatsoever. And then I know you and I have talked about this for off and on for the last almost 2 years now about these possibilities of doing that. So Abby asked, so what does group mean? So in this sense, this would be something like those of us who are on this in this Zoom now would have a possibility of establishing some kind of group plan. Is that what this is saying?
Yeah, well, anybody that wants to join, for sure. The group plan, it is possible. It's just everybody has to pay, and they have to pay on time. Because what the insurance company is looking for is they're looking for one check coming from one source going straight to the carrier. Doesn't matter who the check is from, doesn't matter where, it just, they want one check. As far as the group itself, we can fly under the radar, offer group benefits. Typically groups are employers, so like the employer would be cutting the check and sending the check off to the insurance company. Since everybody is in different states, typically that would work because the company's got a home base in a particular state. They've got payroll. They do all that good stuff, and so they're able to collect all that regardless of where people are working, and then send that check or cut that EFT off to the insurance company, and the insurance company's happy, and they keep the plan in place. So that's really the mechanism in terms of how group insurance would work. My colleague Mike, who was supposed to be on this call, he is the benefits manager for a company called Benefits Mall, and he's my de facto when it comes to this, working these groups and administering the MEC plan. That's who I work with all the time, and we've talked about it extensively, and he said, yeah, it's completely possible. It's a long shot, but everybody that's going to be paying into the plan, because one of the caveats is if somebody misses one payment, then everybody gets canceled out.
Got it. So in that case, so then the biggest hoop here then is kind of administration of the funds and making sure that somebody is actually managing this group plan, which would normally be done by a company. They would have a health. I know a lot of I've worked for companies that have had health, like schools have had health people who handled that, right? Handled the payments and things along those lines. So the biggest hoop, it seems like then is just the administration of the funds and making sure that everything is covered.
Yes.
Okay.
So it's basically all the funds would go to one, either Venmo or Zelle into one account. That account then would have to have set up an EFT every month to go to the insurance company. The other part of this is a group plan, right? Unfortunately, you guys aren't a classic group or an employer group where half of the premium is going to be paid by the company. That means everybody's got to be footing the bill full price for their health insurance, and that can be a costly endeavor because these group plans are super rich in benefits and they're costly. So that's the trade-off as well. I'm not going to, paint this as some, magical thing. It's like you're going to get what you pay for, but you got to pay for it, and then you have to pay for it every month. And then that person that's administering, this bank account, whoever it is, has got to make sure that everybody pays every month, and then that gets paid to the insurance company. So those are the moving parts. Again, it is completely possible, but again, everybody's got to afford the group insurance, and then someone's got to step up. Well, they got to be able to afford it. They got to pay on time, and then the person that they pay into has got to make sure that gets paid off in a timely manner to the insurance company. But it's going to be group benefits, and the benefits are going to be way better than this MEC plan. And we can build those benefits in any way that you want. And that's kind of the upside, is that there's not going to be a cookie cutter, like this is plan A, plan B, plan C. Like there's a bunch of different plans, and we can construct them the way that we want to when it comes to this group insurance, choices. You're not just going to get one or two or three choices. We could probably come up with 5 or 6 in regards to, and again, the pricing is also going to be different based off of the state and then based off of the zip code that you're in. That's also kind of a work in terms of how insurance companies price, because believe it or not, some zip codes are unhealthier than other zip codes. And so those zip codes can be more expensive. Like a zip code that's going to be in Alabama or Louisiana is going to be a lot more expensive than a zip code, here in Los Angeles or, someplace where they deem people to be more healthy. You guys are in a profession of voiceover, so that's not something that's like, a construction worker or even, like a landscaper, which they might consider a more dangerous job, which would drive up the price of group insurance.
And so I know kind of with like workers' comp insurance, I know voice actors. I run a paymaster service. Like workers' comp insurance is extremely low for voice actors if you can negotiate your workers' comp, because we all work essentially. Say we can show that we work from home. So then that would kind of lower this as well due to the profession that we're all in.
Yeah, you have a very, you're not putting yourself in a dangerous position. You're not driving a forklift. You're not, trying to think what other, like even hairdressers can be, a dangerous or unhealthy position because they're working with chemicals. Okay. You guys, yeah, voiceover, you're around a lot of electricity, but that, then they'd have to charge everybody for cell phones.
I've never heard of a voice actor having an electric shock accident.
Yeah, but I'm just saying, like the whole radiation thing, like, cell phones are supposed to give us brain cancer and all that stupid shit. Like, I'm just trying to think on, what could be possible factors of driving this, driving the cost of insurance up.
Yeah,
and again,
or proving that you can drive it down if we can show that you're in a healthy or safer environment for your work then as well then.
Yes.
It's like possibly, right? Okay.
Yes.
Okay, cool.
So I hope, the whole group insurance is possible. It really, really is. But like I said, those factors need to be met. We got to be able to afford it, pay it on time, and then have an administrator go ahead and pay it. But the benefits we can construct, we can get them really good, and they'd be very comprehensive.
And there's no, so I guess there's no so is there a qualification for what makes a group that lets them get group health insurance? Is there a minimum number of people we would need, or what would be the qualification in that sense?
The more people that we get, the lower the cost will be for sure, but no, there isn't. You can do groups of 5 or 6.
And just any group of people that can show that they have some connection to each other?
Yes. Yeah, that's where I would defer. I was going to defer to Mike because this is his business, and I don't know the sorcery that he would pull off, but there is some sort of sorcery that comes with that in terms of, putting a group together down on paper. And again, this is nothing illegal. We're not going to be going to insurance jail by any stretch. Trust me, because we are in a for-profit environment, the insurance company is going to want to take your fucking money. Like, they're going to want to take that money, and with voiceover actors, they're going to look at you and go, oh, what a healthy group. Because that's how how you guys would look on paper, is that you're a healthier group because you're just voiceover actors. Again, like I said, you're not hairdressers, which you're exposing yourself to chemicals. So at the end of the day, the insurance company will gladly take your money because according to their actuaries, you're going to cost less in terms of, using your insurance, because that's, again, what it comes down to. How much is this group going to use the insurance because you're in an unhealthy group or demographic of workers? So Mike would be, the best in terms of laying out the granular, map in terms of how that would work. But yeah, a group is a group is a group.
And I think that's where the argument comes in. With some people are saying that it's not, that the group doesn't qualify as a group for group. So that maybe something that you and I can go over and Yeah. So
Yeah, I mean, Mike would be able to answer that question more specifically, but again, I wouldn't be having this Zoom and blowing smoke up everybody's ass if it wasn't possible.
yeah, cool.
I mean, that just would be a waste of time. Like, I'm not gonna, this is not a bait and switch of like, hey, buy the shitty mech plan. Like, ha ha ha. No, that's not how it operates. That's not what I'm trying to accomplish here. I'm trying to actually become a resource for your group with anything that is insurance based, especially health insurance. Because I mean, fuck, we've been in this stupid pandemic for, 18 months, and health insurance and healthcare, like, I just went through a major surgery, dude, and I'm telling you, man, I don't wish it upon anybody, but having insurance and the doctors and all the people that I saw, was very beneficial. And it was, what's the word I'm looking for? It made me at ease knowing that I had something, especially in this day and age. And so, again, that's kind of why I'm doing this, is to be able to offer a resource to help people. But yeah, the whole possibility of doing a group plan, it's possible. We got to jump through a few hoops, but like I said, I wouldn't be doing this if it wasn't possible.
So we've got, so just like to recap on what we've got. So you've got the mech plan, you've got the ACA if it's available in your state, and then you've got a group plan if you can put together a group. And now, is there an option if you just want to just go straight out and just straight up buy healthcare?
Yeah, I mean, that's through the ACA plan. I mean, you got to be
Okay.
willing to give up your taxes and be completely transparent.
Yeah.
Some people aren't willing to do that. Like, they want to give a big giant finger to the government, which I don't blame them.
Yeah.
But that's the game that you play when you have to go to the ACA. Is it's another layer of transparency and compliance and bureaucracy, or you just go into, whatever health exchange or whatever market you have in your state, and you're paying full price. Well, if you're going to pay full price, you might as well get a group plan that's got better benefits than what your state's going to be offering.
Right. And is there? Yeah, Karen, go ahead.
In the chat, we have a question, which is, what would the price range be in something like a group plan? I think you said like between $200 and $1,000 a month.
Yeah, it's hard to say because I mean, that's a pretty wide berth, and I apologize, but every group is specific. So, and every demo is specific. So when it comes to Pennsylvania, and those zip codes, comparatively speaking to Ty in Arizona, comparatively speaking to Tim here in Los Angeles, all those zip codes are different and actuarially run differently. So, I would say, to be fair, it's going to run between $300 and $500
a month.
A month.
Which,
but it's going to be, these plans are going to be comprehensive with low deductibles, unlimited doctor's visits. Like, they're not going to be bullshit plans that might be offered in your state, or, the mech plan, which to me, I'm not going to lie, is kind of bullshit. But for someone to have that and not have insurance, I would much rather have them have that and have access to doctors and have access to, healthcare than not have it at all.
Which, going back, like, that's, what I was on originally, which I literally, I was in a motorcycle accident with no insurance and came out of that with no insurance. And that's kind of about the time that I crossed paths with you and got, some more comprehensive insurance. But, I had basic coverage for a long time. Probably less than the mech plan. Sorry, Karen, I didn't mean to cut you off.
We have two questions in the chat. For any of these plans, including the ACA or the mech plan or a group plan, is there a minimum or maximum of income required for any of these plans? Like, do you have to earn under a certain amount to be able to get the mech plan? If you earn over a certain amount, will the ACA cost you a lot more? Is it income based?
Yeah, so the ACA is income based. So anything for an individual over 40 grand is going to basically cost you money. If you can show on paper that you make like around 20, so I think in California, or I know in California, the poverty line is 17,600, I believe. So anything below that, you are considered below the poverty line, and like then you would go to Medi-Cal here in California. So when it comes to the sweet spot of the ACA plan, it's between 20 and 30 grand. If you can show that on paper, And if you have an exchange, then you're going to get a really good plan. But again, you got to jump through those hoops. You got to submit your taxes. You got to do all that stuff to go into whatever the government health exchange is or the ACA in your state. Anything over $40,000 to $45,000 is when they deem you to be making too much money to where you're not going to get a government subsidy that's going to help you with your premium.
And in
But
that
it's-
case, you would then pay for the full. You would have no subsidy and pay for the full price of the plan.
Correct. Which means that, maybe a group plan might be, better because they're going to have better benefits. I mean, I'm on a basic plan and it covers me great, but I know what I'm getting into. It just depends also on your healthcare. Like maybe you're a person that, look, I have a wife and 2 daughters, and there's just more moving and working parts when it comes to females. So female healthcare is super important. And my wife and I are, I get it. Like I'm not one of these knuckle draggers. It's like, I don't get it. No, I totally get it. I mean, women just have more moving parts. And so healthcare for women is super important. And you might need a plan that's got more benefits so you can see your OB or see your doctor, have access to birth control, hormones, whatever it is. Like that's super important too. So some of these plans that are offered through the ACA might not fit that bill for you. And if you're paying full price and, looking at a group, plan could be a possibility. I mean, you get what you pay for. With the ACA, these plans, I mean, they're getting worse and worse. I mean, these companies are writing healthcare basics out of these individual plans because it's costing them money. I just consulted with a client that's been one of my clients for a super long time, and his wife's might have a problem getting pregnant. And here in California, on the individual side, there are no infertility benefits whatsoever. No PPO, no HMO, nothing on the individual side will cover infertility because these insurance companies are like, yeah, we can't make any money off that.
A question from the chat. If we did this group insurance plan, would the rest of the group be affected by price if someone has more claims than others?
No.
Okay. So it would
No,
stay
it's not
the
like
same.
it's not like car insurance where they fuck you in the drive-through. Literally, it doesn't work that way. I mean, they
Okay.
work off of actuarial figures in terms of you're a voiceover group, you're less expensive. So if you have claims, I mean, that's, if you're the only one out of 15 or 20 people that has claims, those 14 or 19 other people are still going to be paying into the premium, which is going to offset any cost this group has in terms of claims or in terms of someone using their insurance. So the price will not get affected and you won't get a price hike. If you were to do group, I'm sorry, go ahead.
Sorry, I was going to ask about that. What about, do people have to disclose their medical history as far as pre-existing conditions go when
No,
you're
it's all
trying to qualify for a group insurance plan?
Group is all guaranteed issue.
Okay.
Everything's pretty much guaranteed issue now. So yeah, the group, the pre-existing thing went out the window with, that's one of the good things about, the ACA or Obamacare, but it was also a great excuse for these companies to go, okay, well, that's great. We're just going to jack up the prices. But group's always been group. They work off of, there's a code for each specific profession. And so they have a code that gets applied to your group. Like I said, hairdressers are more expensive because they work with chemicals. People that work in a lumber yard, they are driving forklifts and they could get smashed by wood. So they work on all those actuarial figures. So, it just goes off of the code and then goes off of your sex, your age, and then zip code. And that's how the pricing works.
Cool.
If we were to try and put together some kind of group option for people to decide whether or not they want to opt into, how long would that take, especially with the deadline for signing up for new coverage kind of looming in the next month and a half? People have to decide what kind of health insurance they are going to get for next year.
We would just have to get a census done, and then from there we would have to construct. It wouldn't take that long, as long as people were able to fill out the census, which is name, zip code, birth date or age, sex, and I think that's it. Because then they were able to look at each zip code and from there, construct plans based off of that and then pricing off of that. So, I mean, if people are seriously looking at that, it wouldn't take long at all. I mean, we could probably get something put together, and let's just say, in a perfect world, everybody on this call wants group insurance, and we put something together, and they find something that they like and that's affordable. We could all have a January 1st start date, if that helps you with the timeline.
And we have until, if we don't meet that deadline, then we have until the end of January.
Well, groups can I mean, there are group renewals, but I mean, if this is a new group that's starting, and I'll have to double check on this, but you can start a new group whenever. I mean, technically you're a company that's been in, we can start whenever. There's no real open or like, I started a group in Vegas and their open enrollment was in August. So there is really no deadline in terms of like, okay, we got to throw this together. We can get it started whenever, but it just, if people are serious about it and they need help deciding what direction they want to go, that's what I'm here for. But yeah, like I said, the group thing's possible. I'm just, like I said, there are some hoops that we have to jump through and everybody has to be on board with, in terms of, making sure we pay on time and getting that all together. Because, if one person ends up not being able to pay, then the whole group gets blown up.
Yeah. So someone had asked earlier about who would admin. I have my company is already somewhat established in that area to be able to handle this. I have somebody who handles all of our payroll here. And Carter and I will talk about this, but I just assume that any group thing that I would admin in some way or another. So unless somebody would like to volunteer and do that, my company's already somewhat established in payroll and other things along those lines. So it wouldn't be a big stretch for us to also add into some kind of healthcare plan here. That's something that JD and I'll need to talk about, because I need to see, some very specific logistics and things along those lines before I can fully say that that's something we could do. But that someone asked earlier about admin, that was where, that's where my thought was originally, if any kind of group plan were to go forward.
Yeah, and I'm in the chat here. I want to just answer a couple of questions. Rachel asked, what is the out-of-network coverage like for these plans? Is there a high deductible? Yeah, we can construct these plans with high, low deductibles, and the pricing is going to reflect the higher the low deductible. Basically, if you buy a benefits-rich plan, you're prepaying for your benefits, right? Like if you have low deductibles and if you have low copays, it's going to reflect in a high premium because you're basically prepaying for those benefits. The out-of-network stuff, I can't answer that question until we construct the plan. Sorry to kind of like not be super specific about that, but that's all going to flesh itself out when we start looking at these plans. And these plans will have out-of-network benefits, but again, we'll be able to look at these plans and construct stuff that has good networks and has good options in the area that you live. And then I've covered California. David says I've covered California. Don't have a specialist visit copays, and it went up $40 a month last year and going up 40 again this year. How do we go about choosing the plan coverage options? We'll have to look at like what we can construct on our side and give you a whole spectrum of like from high to low in terms of like, basic to good plans to like great plans. In terms of, the options that we give you. Yeah, Covered California, again, the reason why those costs go up is because these companies make money. I don't know if you know this, but the CEO of Anthem Blue Cross makes $40 million a year. I mean, I don't know if he does anything that magical that he deserves $40 million, but he's the guy in charge, and so he gets to do that. but all those costs make your costs go up because we're in a for-profit environment. And I don't want to sound like I'm some socialist. It's just a reality.
Oh yeah, no, I've fought with insurance very many times in my life. So yeah, I very well. I'm one of the few people I think that's very knowledgeable about their insurance. You know, the people are like, I don't know, it's there. They don't, you know, I've had to fight with my insurance companies multiple times. So I'm on board with you. It's just it's crazy what you don't get. Luckily, they, you know, the stimulus bill reduced the plans. That was double. I was paying double what I am now, but they added money, and it was like it's not even worth it. It's not worth the paper that it comes in. So yeah, trying to get out of it is the best thing. The plan options are just not good unless you pay a ton of money.
Yeah, but what I can say is that, like, I have the bronze plan. It's a basic plan, and it saved my life twice. I do have to pay out of pocket, but, you know, I was able to access my doctors, and I have you know, my body's trying to kill me, unfortunately. Not in a bad way. It's just, I have coronary artery disease. And so 3 years ago, I had 2 stents put in my body, and we caught it, and I don't have any coronary artery. You know, obviously I don't crush McDonald's. I have a propensity of making plaque. And recently I had open heart surgery because my body rejected the stents, and my doctors have no clue. So it's kind of one of these head scratchers of like, Jesus, my body's trying to kill me. But I did get the care that I needed, and I did see my cardiologist, and they did, you know, I do have a decent bill that I got to negotiate. So the plans do work. We're just trying to find that sweet spot in terms of how can we provide good health care at a good price? Because I'm a 1099 employee just like you guys. And so it is kind of shitty to look at these plans and go, you know, and yeah, the stimulus did help with the cost. But until we can get some sort of, you know, national, you know, payer plan, or like, you know, kind of like Medicare for all, these premiums are going to continue, and these costs are going to continue to go up. You know, and it's good that you're on top of, David, your healthcare, because I think it's paramount. I mean, nobody's getting any younger, and, you know, getting old sucks, and like stuff's, you know, starting to change. But again, the whole purpose of this is to try and find a sweet spot for all you guys. There was another question. Any advice on how to find decent doctors in Obamacare in Los Angeles? Everyone in the plan has been awful. The one thing I can say about that is just like, do your research, so you can go to the websites, and it just depends on the plan that you have too. Like if you're on HealthNet or one of these Oscar plans or LA Care, those are kind of the smaller upstarts. I only sell Blue Shield because I know they have the biggest network of doctors. And then from there you can filter out, and then I always call to make sure the doctor's contracted with my plan. And then I also look up reviews in terms of, you know, who's seen this doctor, how many reviews they have. And then you can also do a couple of different, like, what are the websites? There's like Health Grades is one of them. There's a couple of other.
Karin mentioned in the chat a ZocDoc, ZocDoc, to check reviews.
Yeah, ZocDoc. I mean, but if you have HealthNet or Oscar or LA Care, there's another one. Those are all startups, and so those networks are super small and they're super shitty. I mean, sure, the price and the premium's good, but, you know.
It was my question, so I'll just kind of address you directly. When I signed up, I had a choice of either LA Care or HealthNet. And so I was like, I don't know, just pick one.
Right.
And I've been trying to work with the ombudsman office to get out of it and go what's called straight Medi-Cal, which means you're out of network. And the system is devised in such a way that you have to have like you know, you have to have like AIDS or cancer or something to be able to do that. And my general practitioner would not even sign the paperwork to say, you know, not that I was trying to get her to lie and say I had one of those things, but basically they won't let you out. Even the ombudsman office are like, yeah, sorry, not much you can do. And within HealthNet and LA Care, I mean, there is no care. There is no care. I went to one appointment for highly rated, gynecologist that I really, really researched and all everything's good. And I walked in and there were 35 people in the waiting room.
Yeah.
And it's like, well, it's just, and the settings are sometimes they're not clean. They're wanting to tell you need all these procedures when you don't, because they generally have no practices. That's why they're accepting Medi-Cal. And whenever I find somebody to go, oh, I'm hopeful of this, I call their office, even though they're listed as accepting Medi-Cal, they just don't even take it anymore. So I just don't know what to do.
Yeah. So you're,
Where my income level is, they won't put me in covered California. They say, no, you have to be in Medi-Cal.
do you have, so what's your, so is your income level, I mean, the poverty level or the poverty level is not to say that you are in poverty, but that's the line of demarcation is like 17,000. I'd have to look it up.
I am below the poverty level. And by the way, the poverty level in Los Angeles County or in Los Angeles City is listed at 56,000 is the poverty level. So, but trust me, I'm way, 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 way below that.
Yeah, the poverty level for an individual is.
It sounds crazy, but that is the poverty level as established by, all the authorities in Los Angeles.
Huh.
But
we might have to have a side. We might have to have a side conversation. Do you have Do you have dependents then?
No.
You're just you.
Mhm.
Yeah, we'd have to then email me. I think Tim's gonna send me my email because that doesn't sound right to me. 56,000 is not the level of poverty when it comes to going into covered California. You can get a good plan around 20 grand of income. Because believe me, I've tweaked my income over the years, when we had kids and did other stuff to be able to get into a good plan because I'm a 1099 employee. So there's something rotten in Denmark. I'd have to look at your situation and see what's happening with that to kind of specifically address that.
Yeah, and I'll do that. And we are at the hour, so I think we're at a good time. If there's anything specific, JD's available, and
Sure.
definitely, as he said, is more than happy to answer. And it sounds like Marlon, you've got some specific stuff that would be good to have you kind of go into more detail with. So it looks like what I'm going to do, and I'll connect with Karin on this and talk with JD some more afterwards. Is we have some viable options for a group plan, is what it sounds like. We would just need to do the census and we need to see what the actual costs are going to be, and figure out a way to make that work.
Yeah, it's
admin wise is if we're talking admin is something that I'll explore with JD as well, as far as how the actual logistics of making this happen. But it's something JD and I have been talking for close to 2 years on the possibility of doing some kind of voiceover group healthcare plan. And last year, just a lot of stuff happening last year that we just fell by the wayside, and losing some friends and things along those lines. This unfortunately kind of got kicked down. So
yeah, because we were in a fucking pandemic.
Well, that too, yes.
Let's be honest. Like the world's just now kind of, well, I don't know about the world just kind of like coming out of it. Yeah, I mean, I'm here to help. Like now that we've got some clarity with stuff, yeah, we've got some options. Like let's work the problem. I'm here to help you guys work the problem with whatever it is.
Yeah. So Karin and I guess we'll gather up. I'll talk to JD about specifics on this, but we'll get together. And see who we have. We need to get a census. And figure out where people are located and see what that means for a group plan. And then from there, if you guys have any questions, you can email me or you can email JD. I'll actually JD, if you want to just throw your email in the chat too, then everybody can have that, and then I'll also add that up, post that on the
here we go.
The event. So
here's the other part of this is that if there are people that weren't on this that wanted, like. The way that this really works out is that if there are more people that jump into the group, that's how the group works. We can do smaller groups, But if there are more people that couldn't be on this call that were interested, because we did push it back an hour.
Yeah, we had close to 50 RSVPs on people who signed up to come to this. So and that was just those who said they were who were interested. So that's just 50 who said they're going to come to this. I'm sure that if we put out a full census and do a broader reach to say this is something that is available, we'll have more people interested as well. So I'll talk to Karin. I know a lot of people here. It looks like actually most people it looks like are actually from the East Coast groups. It looks like and there's JD's email address, and that's obviously his website as well. So if you wanted to go check out the website, you can see what else.
Yeah, here's my website. I mean, it's a website. It's not super sexy. It just is something that says I am a normal person and I have a web presence. But I'm a person that engages through emails and on the phone. So this is a person business. This is not a website business. If I was doing porn, I might have a website business, but I'm not.
That's good. All right. So with that, unless anybody has any pressing questions, we'll leave on that note. Anybody has any pressing questions they want to throw in the chat or jump in to ask about real quickly? Otherwise, David, did you have a question? You're just waving up there. Oh, David was leaving. That's what he was doing. So hopefully this was answered some questions. I'm sure it raised more questions, obviously, for a lot of people, and there's some options. So hopefully at least you walk away with this with some options of what's out there, the reality of what this system looks like currently. And I know, I guess, JD, I guess things change yearly too. So, things are going to change next year, and legislation comes down and things change. It's very fluid.
Yeah, I mean, I would like to make this kind of a, yearly thing, if not every, month or 6 months, just to be a resource. I mean, I think it's super important because, again, I hate to bring this up again, but yeah, the coronavirus kind of threw a monkey wrench in with a lot of stuff. So, I just want to be a resource to everybody. I'm in the same boat. I'm a 1099 employee, man. I get up, I slay the dragon every day. So again, just here to help as much as I possibly can when it comes to, health insurance or any kind of retirement, anything insurance based. I have done it. I can do it. We can figure it out.
Yep. Yeah. And that's great. And that's kind of, one of the things, at least we see that there's some options and it's not just a screaming into the void and hoping that we get some kind of random answers back from somebody. So hopefully this, this helps for that. And if anybody has any last minute questions they'd like to throw out, everybody has JD's save his email. I'll have it as well. And everybody has a way to contact me if you need to. Hopefully, I think we're all on Facebook together. If we're not in the groups together, you can always track me down. Otherwise, JD, thank you so much for being here tonight.
Hey, thanks for having me. It was a lot of fun. It's good stuff here.
Yeah, and with that, awesome. Go, you're welcome, Marlon. Yes, and we did see one former Brit here, or current Brit living in America, as with some some questions as well. So and then somebody who's going to be off their, I think Rachel, you're going to be off your parents' plan. So getting into a whole new environment of things. So with that said, I will bid you all a good night. And definitely let me know if you have any questions. Y'all have JD's email address, so please reach out to him. And I'll follow up with JD on some of these specifics and find out what exactly we can do to get some solid numbers for people and what we need to make that happen. So
yeah, we can do that tomorrow. I'm going to be sitting in front of my desk all day tomorrow, so we're in good shape.
Yep, we'll do it tomorrow.
Okay, dude.
Awesome. Thank you all, everybody.
All right, thanks, guys.
Have a good night.
You too.